most famous physical therapist on the internet.
Howdy, folks. I'm Bob Schrupp, physical therapist.
Brad Hennig, physical
Together
therapist.
we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today we're going to talk about neck pain, pinched nerve. When do you need to see a doctor immediately? Brad, we're going to actually break this down into two categories.
Okay.
So one, the first category is not as urgent, is that you should schedule an office visit. I mean, you should see a doctor. But two is when you probably should seek emergency medical care right away.
Sure.
So let's start off with the first one, Brad, for an office visit. If your neck pain just keeps worsening despite your self-care, it's probably time to go in and see a doctor and make sure something serious isn't going on.
Right.
You may need physical therapy, so
Yeah.
you need to see a doctor.
If it's restricting your sleep and it's getting no better or worse after 2 or 3 nights and you can't sleep, I mean, you've got to get sleep. Things don't heal well if you don't sleep.
That's right.
It's a bad situation.
It landslides in the wrong direction.
Yeah.
If the pain is radiating down your arm or legs, especially your legs, that could be really serious. And it seems to be from your neck. I would definitely go in and see a doctor then. So.
And then, to be clear, pain could be numbness, tingling, burning, feels like cold water is running down your arm. All those things are associated.
Those weird sensations.
Yeah, with a nerve being irritated.
Yes, it's amazing if you want a variety of different sensations, you get a nerve involved.
Right.
So, if it's accompanied by headache, numbness, and tingling, I would probably go in too, especially if it comes on suddenly and it's the first time you had it. Then it might be an emergency.
Right.
If it, so if you're one that normally doesn't get headaches, and all of a sudden you get headache and the numbness and tingling.
Right. Especially, if you look up and that gives you a headache or dizziness associated with some head movement. Well, we should maybe save that for the latter one.
Sure. So if it's so bad, the pain, like Brad kind of indicated before, it's just affecting your normal activities and your sleep. Yeah, it's time to go in. It's just, you're sick of it.
Like, I had that pretty severe bout a couple of weeks ago, but it happened on a Sunday night. Monday night, Tuesday night were very uncomfortable, but by Wednesday it started getting better.
Well, you know what you're doing, too, and you knew what caused it, too.
Right. But probably if it's not better within a week, you gotta get
that's
it
the next
checked
one,
out.
Brad.
Oh.
If it lasts for weeks, it's time to go in and check it
Mm.
out. We talked about tingling. If there's any tingling in any part of your body, if it seems to be from your neck, check it out. If it comes with urinary or bowel incontinence, now this is actually an emergency.
Right.
I don't know why I got that in the office. I would say that's more of an emergency.
Right, yeah. If you cannot control your bowel movements or your bladder control is clearly thrown off and you have these other symptoms, that is an emergency from what, that's what I've only had 2 people over 20 some years. And actually they went in and they didn't need surgery.
I had one person and it was the same thing. They went in, it wasn't that. I've treated people after the fact though that had it and became paralyzed.
Yeah. So that is something obviously we want to get at immediately.
This one too, could be an emergency if it comes on real suddenly. If you have weakness in your arm or leg. If it's a gradual thing, comes on slowly, then you can probably send an office visit. But, we're always worried about whether or not it's a stroke or something like that. So you want to make sure.
Yeah, if you can't pick something up that you normally could, and you got numbness and weakness, you got to.
It's time to go in.
Yeah.
So these are definitely emergency medical care situations. So we'll go into these now. One, if you've had a traumatic injury, like a diving accident or you're in a car crash or. Don't mess around with it because you could have a fracture and not even realize it. You could have what is called a hangman's fracture, and your neck is unstable, and you could actually become paralyzed. So you really don't want to mess around with it. So if you have a high fever along with your neck pain, then we're worried about meningitis, Brad. And the membrane covering your spinal cord and brain. Get an infection and you don't want to mess with that.
Builds up pressure.
And you want to go in and have that treated, obviously. If you have a severe persistent headache accompanied by nausea, weakness, it's time to go in right away.
Right. Particularly if you're one that doesn't have headaches
Okay,
or headaches
yes.
like that. in the
Yeah,
past.
if you have migraines and you're used to it, I mean, that's a different story.
Right.
Yeah, nausea or vomiting. I always, that is probably beyond the neck pain there. So if you have a rash, if you have sensitivity to light, if you have a racing or irregular heartbeat,
Sure.
these are all things, if it's along with your neck pain,
Yep.
still difficulty breathing. Like we said before, pain or numbness radiating down the arm that just started suddenly,
Yep.
and pain in your chest or jaw.
Right.
Yeah, we're obviously
right.
worried about a heart attack, so you want to make sure you check that out.
And
So,
I think if you had all of a sudden pain or numbness down both arms at the same time,
yes.
then get in, because that's more unusual to you. So get that figured out. It very well could be something that's not serious, but you definitely get that.
You always
checked
want
out.
to be on the safe side here.
Yep.
So, thanks everybody for watching.
Very good. Oh, what about our PDF? We'll skip it.
Oh, sure. Well, this program, by the way, is a part of a series of videos on neck pain. If you want to check out the whole program, go to bobandbrad.com, go to the program section, look for the neck pain. There's about 30 videos. You pick out the ones you want to watch.
Right.
You don't have to watch each one. They're all free. We don't require an email, anything of you. You can just check them out.
And they have a PDF printout, little review of exercises and what we talked about on the video. It's all free. There's no email and anything. It's just our gift to you, and would hope that you improve and become healthy, fit, and pain-free.
Like this one,
Oh.
now on this video, you can look at the list. See, what symptoms do you have, and what
Sure.
should you be doing? So
Right. Yep.
you don't have to write them all down.
Yeah, that's
So,
a good deal.
all right. Take care.